Hi everyone, this is Dr. K. Wanted to quickly talk about what you would find when you're doing an autopsy after somebody with COVID dies. So I was looking for some studies on like any papers or anything that's available about this kind of research. So the reason why I'm doing this is there's a lot of misinformation online and in the news that all of the docs are getting paid extra to diagnose somebody with COVID, even though they don't have COVID. It can happen inadvertently. None of us, at least here in the local area, are getting paid more to diagnose somebody with COVID. It may mean a difference for the hospital. Hi, Ladonna. You have to realize the hospitals are paid differently from the doctors. For example, if somebody has Medicare Part A pays for the hospital, and Part B pays for the physician fees. So even though it's the same insurance, it's paid differently. So there is some controversy that if somebody is on the breathing machine and they have COVID, hi Karen, the hospital gets reimbursed around $40,000 or $40,000 from Medicare. And if they're not on the breathing machine and they have COVID, and then in that situation, the hospital gets reimbursed around $12,000 or $13,000 per case. And that may be true, and I don't know the exact details. I'm not allowed to know that, and I'm not into the insurance industry. But it really doesn't affect how the doctors get paid. The doctors get paid per visit, and it's separate from what the hospital gets paid. And also there's another controversy that the doctors get paid more or the hospital gets paid more if the doctor writes COVID-19 as the cause of death. I really don't believe that, and I never got a memo from corporate asking me to do something like that. Now, obviously, if somebody dies from COVID, the doctor would put COVID-19 as a diagnosis on the death certificate. But they would not have a financial incentive, or they would not have a pressure from corporate to do that, at least as far as I know. So that's why I want to review this paper. This was published on April 23rd in Scientific American Journal. And this is a series of autopsies that were done, and they documented the results from the autopsies of these cases. So I'm going to briefly review for a few minutes, and this is a well-known publication. This is peer-reviewed, which means this is before something is published, two independent authors who are not connected to the author who's publishing will review the article, and unless it goes through a rigorous peer review process, it doesn't get published. So case one is a 77-year-old man, somebody who is older, and they were having fever and chills for 6 days, and they eventually on March 20th, they called the ambulance to go into the hospital. The only medical issue, a pre-existing medical issue they had was high blood pressure. On trip to the hospital, this particular patient was gasping for air and their heart stopped. So by the time they showed up in the emergency room, it was too late, and they passed away. And they were not seen by a doctor for the fever in the preceding 1 week or so. So in this particular situation, they were not tested for COVID-19, and nobody knew if they had a heart attack or what happened. So this happened in Oklahoma City. Hi, Patricia. This happened in Oklahoma City. So the medical examiner decided that because there was no clear cause, they're going to do an autopsy. And they did the autopsy, and they found out, they found out that this person's lungs were 2 to 3 times heavier than usual. And they noticed diffuse swelling throughout the alveoli. So the final diagnosis was diffuse alveolar damage. Now, when the trachea, it bifurcates into the bronchi and the bronchi into the small sacs, and those small sacs are called alveoli. And that's where the oxygen is exchanged into the bloodstream, and carbon dioxide gets out, and you exhale the carbon dioxide. So there was diffuse damage in all the alveoli in the lung in this particular client. And the pathologist or the examiner labeled the diagnosis as COVID-19 because it was fitting with the clinical picture. So although this case, they were not tested for COVID-19, the autopsy revealed that this particular client had COVID-19, and that was the cause of death. So that's case number one, okay? Case number two is a 42-year-old, relatively younger client, but they did have myotonic muscular dystrophy. So myotonic muscular dystrophy is like weakness in the muscles in different parts of the body. Some of them may have difficulty walking, they may be in the wheelchair, some of them have difficulty swallowing. So this particular client went to the hospital, they had abdominal pain, and the CT scan showed some fluid in the lungs. And eventually the heart started pumping and they passed away. So, so the diagnosis that was labeled by the physician was community acquired pneumonia. So they thought there was a lung infection. And they were also on the death certificate, they labeled the client as COVID positive. When the pathologist did the autopsy, they noticed that the client did not have the picture similar to the previous case. So they did not have the alveolar damage. What they noticed was they found food particles in the bronchi in different areas in the lung, and they also noticed bacterial infection in the airway. So that suggests that this patient probably had some weakness in the throat, and they were aspirating where the food was going down into the lungs. And that's how they developed the aspiration pneumonia. So in this case, although the doctor labeled them as COVID-19, the pathologist decided that the cause of death was aspiration pneumonia, but not COVID-19. So in contrast to the previous case, although the doctor labeled as COVID-19, it was not really COVID-19. So you can see in both of these cases, and this is published recently, April 23rd. You see in both these cases, although the doctor labeled somebody with COVID-19, doesn't mean that they died from COVID-19. They may be positive for COVID-19, but they may have died from something else. And the opposite is also true. The doctor may not know, or the patient probably already died by the time they reached the emergency room, or they died at home, and nobody knew that they had COVID. And unless you do the autopsy, you would not know that they died from COVID-19. So this brings the question, we really don't know the real rate of death or mortality from COVID-19 because of all of these issues. It's very complicated. And it may take 4 to 5 years or even 10 years by the time we figure out what the real mortality rate is. So until that time, instead of speculating, we should wait and see what the real numbers are. I don't think, there may be some corrupt doctors and healthcare workers, but the vast majority of them are trying to do what's best for the client, and they are not doing stuff because they have a financial incentive. You cannot blame the doctor. For example, in this second case, the doctor probably labeled in the death certificate as COVID-19, but the patient really died from aspiration pneumonia. You can't blame that particular doctor that they're trying to trick the public, or they don't know what they're doing. You can't do that. So until we have more autopsies like this happening, until these are reported in journals, we would not know the clear picture. So I don't want you to focus on the news. There's a lot of fake news. I want you to just work on your immunity and try to relieve stress. Now that the shutdown or lockdown or whatever is over, people are able to go outside. They're able to go about their normal lives. They're trying to reintegrate into the society, which is what we really want. So I believe that you should really focus on your personal health, the health of the family, and try to maintain a proper lifestyle so that you don't have to deal with COVID. Okay. So I want to briefly share this. If you have any comments, please share below. Also, if you need to call me, you're welcome to call or send me a DM. Look forward to talking to you all tomorrow. Have a wonderful and happy weekend. Okay, bye.